tummy tuck alone, your procedure is going to last about 2.5, 3 hours. It depends on if you're getting other stuff done too. A lot of our patients will go home the same day, but if you are at increased risk or if we're doing more procedures, sometimes we will have you stay overnight one night. Regardless, either that day or the next day, you will be sent home. You will be sent home in what's called an abdominal binder, which is a garment that's not too compressive and can kind of be adjusted after surgery. You may also have some lipofoam or some gauze around the area. Most of my tummy tucks do have a drain that comes out from the groin area. That's to decrease your risk of getting a seroma or a fluid collection that can hurt your result in the future. Once you get home, make sure that you have a recliner or something that kind of can help you in that flex position for the next couple days. You want to make sure that you're not really laying on your sides because that can be painful, and you're not going to want to lay directly on your stomach for probably a couple months because we pull you nice and tight. Most people are a little bit hunched over afterwards. Most people can stand up all the way at about the 4 to 6 week point after surgery, and they're starting to stand up straighter at about the 2-week point. As far as restrictions after surgery, absolutely no lifting more than 10 pounds for 6 weeks. We don't want to strain that muscle repair that we've done or that scar at the bottom. We also want to make sure that you're keeping up with your drain appropriately, that you're taking your medications appropriately. Those are going to include a pain medication, a Valium to help with that muscle spasm, which is kind of that burning pain that you get right around here from those muscles being tightened, an anti-inflammatory, and your antibiotic. Also take your blood thinner if that's been prescribed. Make sure to keep up with your drain output so that we can get that out as soon as possible. And if you have any other questions in your post-operative care, make sure to ask us and we'll go through all of that. Most people take between 2 and 4 weeks off of work afterwards. People that are a little bit tougher, that have desk jobs, tend to be on the lower side of that. People who have a little bit more, nurses that are walking around a lot or may have to lift, take more of like the 4 to 6 week off after their surgery.